Okay, so first I would assist my patient into semi-Fowler's position, which he is in. This is when I would perform suction on the tracheostomy tube if necessary. And then once I've done that, I would, excuse me, open the tracheostomy kit, which would be sterile. And I'm gonna remove everything from the basin except for the sterile gauze pads and the applicator tips. So once I've done that, I would pour the soaking solution with the normal saline into the basin. And once I've done that, I'm going to perform hand hygiene and apply clean gloves. Once I've applied clean gloves, I'm going to, once I've applied clean gloves, I'm going to remove the patient's oxygen source, and I'm going to unlock the inner cannula. So once I've unlocked it, I'm going to unlock and remove it and place it in the soaking solution. Once I've done that, I'm also going to, while securing the tube, I'm going to remove the soiled dressing and place this in the garbage. And this would be, the tube would be secured the whole time. So once I've done that, I'm going to remove my now soiled gloves and place them in the trash and perform hand hygiene. Now I'm going to apply sterile gloves. I would drape my patient's chest after I apply sterile gloves. So going to pinch the inside. And then I would reach on the inner portion of the cuff. Touching the sterile side, and then pull that down. My hands are sterile. So then I'm going to take the inner cannula with the solution and I would clean it. So I'm going to clean the inside of the tube thoroughly and the outside. Once I've done that, I'm going to place the tube back in and lock it in position. Once I've done that, I'm going to use the applicator tips that are soaking in the hydrogen peroxide solution, and I'm going to clean around the incision site. And all while I'm doing this, I would either have an assistant help me keep the tube stable, or I would do it myself. And I'm cleaning from the inside of the incision towards the outside. Once that's clean, I would throw the soiled tips in the trash receptacle, and I'm going to take one of the sterile gauze squares and thoroughly dry the patient's skin and the tube flanges, and again keeping the tube stable and secure. And then I'm going to discard of that. Once the tube is completely clean, I'm going to replace the sterile, not replace, I'm going to put a new sterile dressing on the tube, still making sure to keep the tube stable. And once the new dressing is in place, I'm going to remove the old dressing.
It looks like you're all
I'm not going to remove the gold dressing, sorry. I'm going to tie the new ties on here. If I had an assistant, I would have them hold the tube in place first and then I would remove the ties, but since I don't have an assistant, I'm going to apply the new ties while the old ties are in place and remove the old ties after. And I'm going to place a knot on the side of the patient's neck to secure it. And then I'm going to place a sterile square underneath the knot against the patient's neck and tape the knot to the gauze pad. Once I've done that, I'm going to remove the old ties. Having trouble taking them off now, but I would completely untie them and remove the old ties and discard of everything. And once I've done that, I'm going to remove my gloves, put them in the trash, and perform hand hygiene. I'm going to make sure before I leave my patient that they are comfortable and that the bed is in the lowest position. And once I've done that, I would leave them with the call light and go document.